Okay, if you guys know a nurse practitioner student or someone that wants to be a nurse practitioner, send this video to them. Have them save it for when they need it. Okay, important things to know. IBS, normal CBC, and SED rate. IBD, not so much. Make sure you know the difference. Glaucoma, the normal tonometry reading. Half life for testosterone. Hypokalemia, clinical manifestation. Niacin and glucose levels. Gallstones, clinical manifestations including knife-like pain. Peptic ulcer disease. Appendicitis. Weak femoral pulse. What are you going to check? Coarction of aorta. Acute attack of gout. What med are you not going to order? Allopurinol. BV and clindamycin. Mild to moderate heart failure clinical manifestations treatment. Erectile dysfunction, what would you order? Quickening, when do we expect to see that? RSVP, nasal swab. Make sure you know about the different types of headaches. Albuterol, sinusitis. Organic erectile dysfunction. Hand, foot, mouth disease. Hemoglobin A1C. Scabies. MMR vaccine. Prostatitis. Hep B. BVP. BVP? What's BVP stand for? BVP. I can't even read my own handwriting. We'll come back to that. I don't know what I wrote here. I'm sorry. Suppressive therapy for herpes. Tinea capitis and Grisio. What food should you tell the patient to eat? Periorbital cellulitis, allergic rhinitis, bleeding during pregnancy, painful bleeding during pregnancy, painless bleeding during pregnancy. Make sure you know what those disorders are. Hep B. If series is interrupted after first dose, the second dose should be administered when? Third dose, when? Separated by how long? Patient got MMR vaccine and developed rash. Okay. If a patient got an MMR vaccine and developed rash, what does that mean? Is it good? Is it bad? What was the reaction? Third generation cephalosporins. Which disorders would you expect to order third generation cephalosporins? Murmur, not good. Make sure you know your Tanner stages. Make sure you know your pediatric milestones. Make sure you know when an infant can hold their head upright. Make sure you know when a toddler can throw a ball. Make sure you know what drugs a woman may take during pregnancy, specifically for hypertension. Which murmurs are you going to refer out to the cardiologist? What do you do if you note papilledema? Gestational diabetes. What size would you expect the fetus to be? What's the first line treatment for diabetic patient. Let me be specific. What's the first line medication? Because for diabetics, the first line, we're always going to tell the patient we want them to start exercising and losing weight and eating healthy. So let me be specific. Medication. First line medication for diabetics, metformin. Make sure you know for hyperthyroidism and hypothyroidism, the T3, the T4, the TSH, what's up, what's down. Make sure you know the time frames for tooth eruption, rotavirus, endometriosis, dysmenorrhea, What vaccine? Oh, know which vaccine pregnant women can take. First line treatment for osteoporosis. When I say treatment, I mean medication. Make sure you know your bisphosphonates. Make sure you know how the patient needs to be positioned for how long. Do they take it on empty stomach? Food, full glass of water, what? Make sure you know tennis elbow. Make sure you know rotator cuff injury. Make sure you know snuff box tenderness. Cauda equina. Shingles, dermatomes, shingles vaccine. If a patient has had a cough more than 3 months, what are you going to expect? Suspect, I should say. Differential diagnosis, GERD, asthma. I don't know if I'm allowed to say this on TikTok. When do boys have dreams? Between 9 to 15 years old. You're going to teach the parent that this is not something that is abnormal. TB screening for Mantoux test. COPD, spirometry, SABA, LABA, saw palmetto, and BPH. Patient presents with petechiae. What kind of labs would you order? You're going to include CBC. Patient has iron deficiency anemia. Which labs are you going to check? You're going to check the iron. You're going to check the hemoglobin. You're going to check the hematocrit. Make sure you know cluster headache. Make sure you know how to test visual acuity. Make sure you know the most common way teens contract hepatitis B through relations. First line treatment for anxiety, benzos. Make sure you know Barrett's esophageal. Make sure you know its link with GERD, and make sure you know its link with cancer, throat cancer. Testicular torsion, make sure you know what that is. Make sure that you know it's an emergency. UTI in pregnant women, first line drug you're going to order for that, nitrofurantoin. Make sure you know about HIV seroconversion. Painless wart, you should be thinking HPV. Is that it? Okay. That's it for now. So that list, if you're studying for your ANCC or AANP, everything that I just mentioned, make sure you know it and everything around it. Clinical manifestations, diagnostic tests, patient teaching, everything.